Okay, ready? 1, 2, 3. Welcome back to episode I don't remember of when the pharmacy closes. I'm one of your hosts, Clarissa,
I'm your other host, Chris.
and today we have a special guest today. Oh, say your name.
Celeste.
Talking to the mic, girl.
Celeste.
Oh, she decided to do the whisper. This is my twin sister. If you're watching the video, I think. Do we look like?
In high school, I confused them for each other.
I don't even think we look that much alike.
For the first time, you did.
Anyways, Celeste here is a nurse, so today we want to ask her a couple questions about her nursing career, maybe how it was in school, and like the experience she has with pharmacy. And I guess just to get to know her a little better. Okay, tell us a little bit about yourself.
Well, I'm a nurse. I've been a nurse for only a couple months. I started back in, I think, July.
Okay.
I started my training with Del Sol in the summer. And then I went to the floors in like September-ish. And then I started by myself in October.
Mm-hmm.
So I've been by myself only for about 4 months.
Wow, she's independent. Okay, and can you tell us about how you became a nurse? Like, what was school like, and how many years it took you?
Well, I went to UTEP. I did my undergrad. Well, nursing is undergrad. So I did 4 years of school, all my basics, and then I finally applied to the nursing program. And then there's 3 phases. Oh, yeah, actually 3 phases of the nursing program. So you do your basics of like nursing, which is like, and then you applied for phase 2, which is more like farm and child nursing and all that. And then you do your phase 3, which is more like clinical aspect of your nursing portion.
Okay, and do you know what made you choose? Like, what made you choose to go into the nursing field?
I was about to ask that.
Oh, well, I always wanted to be a nurse because my mom's a nurse, so she kind of guided me into that route of being a nurse. I always I always wanted to help people, and I always have a kind heart, like helping other people. And yeah, so that kind of led me to being a nurse. I just like the hands-on portion and talking to other people and getting to know other people.
Okay.
You mentioned that your mom was kind of like an inspiration for being a nurse. Have you noticed any sort of differences in, I guess, when she was in nursing school versus you in nursing school?
I guess from what she's told us, like you.
Did she go to UTEP?
No, she went
She went to community college.
yeah,
Ah,
community.
okay.
Well, I don't know. Mine's different, I guess, just because mine's a bachelor's degree. But it's a lot more competitive than people think. Like, if you're going from your phase, like, your basic, like, nursing, it's more competitive to get into phase, I think, too. Like, I can't remember, honestly. But there's one competitive phase where everyone's, like, out to get each other. No one wants to help each other with classes or with homework because you're trying to obviously make a spot into the program.
It's like the
So,
Hunger
like,
Games of
Every
nursing
man for
school.
himself.
yeah, every man for themselves, unless you have like really good friends that are like each of your goal is to like get into the program. But like in this part, everyone's out for like just selfish. They think of themselves, and you have to kind of do it yourself. I never studied more in college until like I actually got into nursing, because it's like so hard. You have to be really focused, and you have to really learn how to study, because if not, you won't make it.
I know like a lot of friends that we've had in nursing, which a good amount of our friends went into nursing, but a lot of them mentioned that like the kind of grading scale is different from the typical like 70 passing and then like 80, 90, all that. Like I
Yeah.
think the passing grades are higher,
The
no?
passing rate is a 75, so if you don't get a 75 or higher, then you fail. And yeah, that's basically 75 or higher, or you're a failure.
Oh,
What happens if
Just
you,
kidding.
I mean, I know you said, okay, you're a failure if you don't get a 75 or higher, but like what necessarily happens in terms of like the phases? If that, like, you don't move on or like,
Well, like phase 2 is basically your pharmacy class, your intro to nursing, and I think it's pathophysiology. So, I mean, that's like your core of nursing right there. So if you don't understand from there, then you're kind of screwed for the phase 3, because you kind of need to know like, your drugs and your patho and how it affects the body and stuff like that. But what I can say is that all the professors are like very encouraging and nice. I can't say anything bad about the program because I felt supported throughout the whole program. I think I've only failed like one exam and I was devastated, but I mean, you have help. You have help. It's not like you're by yourself. The professors are willing to help you out if you fail, you know? So,
Should we get
but in
into
terms of
the-
phase 2, phase 3, I honestly can't remember. I can't remember like what it was like. I just remember you have to really study and everyone, like it was shameful if you failed and you had to like really, really pass.
Not
Because everyone
shameful.
wanted to pass. Yeah, you felt like, oh my God, it was my fault. I could have studied harder,
Aw.
you know?
That's how I felt in pharmacy school, but right now I just care about getting 70 and pass.
I know, like, I think pharmacy school is just as intense per se, but not intense in the
75% or higher.
yeah, like it kind of just passed the class like a normal grading scale.
Yeah, like normal grading scale.
And I think that's just because it's very competitive. So they want us to like really
Excel.
excel in the program because everyone wants to be a nurse.
And they
For
wanna
the most part.
produce good nurses. So I mean, it's a good program.
Yeah, it is a good program.
I mean, they can produce as many nurses as they want, but doesn't mean they're going to be a good nurse.
That's true. I mean, it,
Did you hear
Is
that
that the
shade she
tea?
just threw?
That's the team.
Should we just get into the juicy part of your nursing career? Well, let me and Chris look at the questions we have.
I was gonna say, I know you mentioned pharmacology, and at least based on like TikTok and stuff like that, I hear a lot of nurses say that pharmacology was one of their hardest courses. Do
I
you
do agree.
agree? Yeah. Okay.
Yeah, I do agree. It is one of the hardest classes because, like, you have to kind of know what medication you're giving and why you're giving it and what can happen to the patient when you give that medication. Like, it's like, okay, yeah, I know what metformin's for. It's for diabetes, but how's it going to affect the patient if you give it? Or, lisinopryl's for the blood pressure, but how do you know how it's going to affect the patient, I can give them like lisinopril and bottom them out. And then you're there wondering why they are lethargic. Well, because you just bottom them out.
Would you guys have like drug quizzes? Would you have drug quizzes?
Yeah, we would have drug quizzes and then we would have tests, or sometimes the drug quizzes wouldn't be even announced. They would be like pop
Oh.
quizzes, so you kind of would
Oh.
have to
Imagine if ours were pop
actually read.
quizzes.
You would have to
cry.
actually read before you went to class or listen to a lecture because sometimes there were pop quizzes.
And then, like, in terms of the drugs, what would they quiz you on? Like, would they on the drug reactions or like how they worked?
Well, I mean, probably not as in depth as you guys, because I mean, you guys are pharmacists, right? So the main things we would be tested on were like side effects, adverse effects, mechanism
dosing?
of action, how they would dose it. What else? What else today?
Well, it's pretty similar to ours, I think.
So far,
Well, we mainly wouldn't focus and now in my career that I'm doing administering medications. I really don't go by like the dosing because obviously I'm not the one dosing the medication or whatever. But the main thing for us is mainly side effects, adverse effects,
What about like
and maybe
formulations?
also mechanism of action. Formulations.
Yeah, like it comes in a capsule or it comes in like a tablet.
Oh, that
or,
too. Yeah, you need to know that too, because like if you're putting in, if the doctor tells you to put in an order for like metformin, of course I don't know, does it come in liquid?
yes, it
Yes, it
does, but it's
does.
not commonly used.
Yeah, it's not common.
Yeah, and so then you kind of already know, like, oh, I've never seen this. Like, should I question it or
Well, then I feel like,
like
you guys.
it's that thing of insulin. If you know insulin's in units, and then you'll see someone administering mLs, and then you're like, like you need to know all that. So yeah,
And do you
pharmacology
guys-
is so important.
Do you guys also have things like Lexicomp and Clinical Farm or something?
Yeah, we do. So we can look up on the computer, like, I don't know what it's called, but we do have a little, like, site where you can look up, like, drug compatibilities, if the IVs match, like, if you're doing secondaries, if they match, or if, like, normal saline is compatible with, say, like, Zosyn or whatever you're running. You have to know if they're compatible. What else? Adverse effects. It does tell you all that.
Okay, that's good.
But yeah, pharmacology is very important. Because if you don't know the drugs and why you're giving them, then you shouldn't be giving them.
She's stating
one-
straight facts.
That's one
honestly.
thing. Honestly, that's one thing I learned through my preceptorship. He would test me on the medications. He would tell me before I even went to the patient's room to give the medications. He'd be like, he would go down the patient's EMR and be like, what's this medication? And I'd have to tell him, like, it's for this and this. And then he'd go down the line.
Dang.
Yeah, and if I didn't know, he'd tell me, look it up.
Look it
Because-
up, girl. Look it up.
I mean, because how are you going to go into the patient's room and be like, I have all these medications and not know what you're giving them for?
Don't you hate it when you ask them? I mean, not when you ask them, when you're giving them medication and they're like, what is it for? And you're like,
You're
So
like,
that's
hold up.
why I make sure I know what I'm giving. And if I don't, I look it up before I go in so I don't look like dumb, like, I don't know, let me look it up. And then you're looking it up in front of them and they're like, shouldn't you know?
That's what I do when we go to UMC and they have like
True.
a drug that I've never heard of before. I always have to look it up before I go in the room because they will ask, what's that one for? Or maybe they don't mention it in their, what is it, medication history? And then you have to be like, oh, you also had one in the system for this, this, and this. So that's why we have to look on Lexicon before.
Yeah.
And at UMC too, sometimes we can give the patient like the medication name and they don't know necessarily what they're taking, just that they're taking something. So we'll say like, oh, are you taking something for your blood pressure? Are you taking something for your diabetes or whatever? And that'll kind of ring the bell.
Yeah.
Yeah, because it's also scary because when we do the admissions, we ask for like the medication rec to see what they're taking. And sometimes they don't know. They're like, oh, for diabetes. And you're like, I know the dosing. Like sometimes I'll be like, lisinopril. And I'm like, 10, 20, 5, when you know.
Like which
And I was
lisinopril?
like, you know what? Just bring the medications tomorrow because I don't want to risk giving you something that you're not used to taking.
Or overdosing you or something like that.
Yeah, so I don't mess with that.
Well, since you're talking about giving the patients their meds, can you give us a little description of how it's been working at Del Sol?
Yeah, so
Or how you started working there and like what's it like?
So, I started working at Del Sol because during my 8th semester of nursing, I did my preceptorship there on the floor that I'm working at right now. And I precepted with, I don't know, I won't say his name. I precepted with a certain nurse, and he was really good. I really liked the floor. All the people and the nurses were really helpful. And, you know, as a student, I didn't want to just, like, you know, sit there and do nothing and be one of those students that just is in the way. So I kind of would offer help, make an effort to learn and stuff. So when it was time to apply for jobs, once I graduated past my NCLEX, I wanted to go back to that certain floor because I was already used to the people and the unit, you know. So they had a hiring event at the Chihuahuas. So I went, I did an interview with the director there, and she hired me on the spot. So
Wow, she hired on the spot.
That's how you know she's good.
I was
so
memorable.
You're one of the students that like went out of your way to like help.
Yeah, and then when I went back as a like actual nurse, a lot of the staff already remembered me because I was one of the students that was really helpful and, you know, just offered my help. I wasn't lazy.
And what made this rotation site different from all the others?
I think it was my preceptor, honestly. I look up to him a lot. He's still willing to help me. Yeah, shout out to him. Let's do the heart.
Oh, wait.
Shout out to him. I think it was honestly him, and just again, like I said, the people, like, that's why I wanted to go back. And then luckily, when I went back, he was again my preceptor for actual work. So he already knew how I worked. He already had expectations for me. He set all those expectations, and he was like, you know what? You know how I work. You know how this is how I like to do it. Like, he held me at a higher standard, and I kind of like that. Like, yes, I'm a new grad. I still have a lot to learn, but he held me to the high expectation of like, and trusted me knowing that I knew my stuff and I knew, you know, the procedures and what I was going to do. So I like it so far. And I still have a lot to learn, not saying that I'm the best new grad out there, but I think
She's like, I consider myself
I think I
well.
consider myself doing pretty well, and I think I've excelled, and just based on the
confident
events
queen.
or the situations that have occurred, I think I've grown as an individual, you know, as a nurse, new nurse, baby nurse.
a baby nurse.
You guys want to hear what a typical day is like? A typical shift?
Yeah.
Yeah, tell
Oh my
us.
gosh, I'm talking till I'm making it about me.
No, it's okay. Well, we brought you on here to
It is
interview
about you.
girl.
Okay, so a typical shift, I clock in, and I
The
don't know.
moment of the mic, she said, I clock in.
And I don't know if it's because I'm still like a baby nurse. And it's not that I lack, okay, maybe it is just a little bit, that I lack trust in the nurses before that they miss something or, you know, because I don't know. But I get there, I look at the assignment sheet, I make sure I see who I'm taking care of and stuff like that. And then I get in the computer, print all my papers, my report sheet, or no, what are they called? They're called patient handoffs. So I print them all. And then I kind of look at the main things I look at, because you can't really sit there and like look at everything before. Because, I mean, you have to get report, and it's not fair to the nurse that's waiting for you, right? So I print those out, and then the main things I look at are the vital signs. I look at the orders, and I look at, basically the vital signs and the orders. And then the EMAR to make sure, this is what I'm going to give throughout the night. Any orders that weren't like done throughout the day. And then anything else I can look at during the time. The labs. I look at labs too. So I do that for my 6 patients, and then I get report. I go say hi to my patients. I come back, look at more orders, kind of write down medications I'm going to give in the night, and then I'll go set my little card up, stock it up, and then I'll go give meds. After meds, I get busy. So I'm like busy from 7 to 8. No, like to 10, 11. Depends on the night. But then, that's it. I get busy. After meds, it's just checking on your patients, making sure it's okay. They're okay.
It's okay.
Making sure they're okay. And then, I mean, things can arise. So it just depends on patient per patient and your situation, And then our max of patients is 6. So if I'm not capped, I can still get another admission, or just depends, That's a typical night for me.
And I know you mentioned you're working graveyards now.
Oh, yeah.
In your clinicals were during the day, I'm assuming?
No, actually, my preceptorship was in the night, so I kind
No
of
way. Okay, so you were kind of prepared for that.
Yeah, I had to do 12 hours in the night, so I was prepared. And honestly, the nights are better, but that's my opinion.
I agree. At least in pharmacy too, I like graveyard shifts.
I've
It's
never
so
done a
much
graveyard shift.
slower. I mean, yeah, granted, you like sleep a lot. I spend my time sleeping. But the night is slower, and especially for a new grad, it's honestly better. I mean, sometimes you have your crazy nights, but it's better because you are able to get taught more things. I feel like you're more hands-on with your patient just because there's not PTOT, there's not doctors coming by, social work, so you're more like able to get to know your patient, And then you're the one that helps them in the night because there's no one there to help you. It's you or your tech, so you get to know more.
I agree with what you said, how it's like easier is better for new grads too. Because I mean, I think for any career, whether it be nursing or pharmacy, whatever, especially even in our pharmacy or in the units, whatever, if you're training someone, it's a lot harder to do when it's busy because we already are pretty much on our feet the entire time, like just minute to minute. And if you have to train someone at the same time, it can get kind of stressful and you miss things.
Yeah.
So I know like when I have to train a new tech, I really hope it's a slow day versus a really busy day.
I agree. I 100% agree with that because in the night I'm able to ask like the other nurses if I have questions. And I have a lot of questions still since I'm still learning. Maybe they're obvious questions, but I feel safe enough to go ask the other people. What's happening over here?
It's because my headphones unplugged.
If y'all can't see, I'm trying to adjust her headphones because they're not working.
I was like,
What has your,
oh, this one's better. Okay.
being that me and Clarissa work in the pharmacy at Del Sol, what has your experience been like with the pharmacy?
Honestly,
Let me scooch you in to hear this.
let me sit for this one.
She said, let me sit up for this one.
No, just kidding. Honestly, I haven't had much interaction with the pharmacy. The most interaction I have is when Clarissa works and she comes to hug me. and I'm nice to the pharmacy people, so because I hear the stories Clarissa says, and that nurses can be a little mean, but I try not to be that nurse.
Thank you.
You're welcome.
No, she has it good because sometimes she'll text me and be like, is this man in the Pixis? And I'm like, I don't
Or
know.
I'm like, are you on the floor? I'm missing this one.
Yeah, she's like, where's this one?
It's because I know she can get it to me right away. But honestly, I haven't had much interaction with the pharmacy unless you guys bring something up that I'm like, thank you. Or I see you guys filling the Pixis or whatever. Or if I miss a med or I have a question about something, I'll call the pharmacy. But honestly, in terms of like interactions, I haven't had much besides those.
I feel like you barely see us. I feel like we go onto the floor so fast. Like we're in and out.
That's
We're kind
'cause
of like
we
ghosts.
have
We're
to
just
be.
like running. And we barely
Yeah, I see you guys, but I kind of respect you guys because you guys are the ones bringing in our medications. So I just lose track of the times you guys come up. So I'm like waiting for something, and I'm like, it'll come right now. I'm not worried that it's not gonna come up. I'm just lose track, and I have to remind myself it'll come. You just gotta relax.
I have a question. Like when something is due, do you have to give it in that exact moment?
No, I think someone was telling me that we can either give the med an hour before or an hour after. So it's not like we need it now, unless it's like they came onto the floor at us an admission and it's like a stat or something, you know?
Thank you for letting me know that.
I know, noted.
I think it just depends on the nurse. Maybe it's just how like
Well, it's 'cause-
particular they are about giving their meds. But honestly, like for me, if I see it's at 10 and it's not in there, I'll like put in the missing med order and just wait for the med.
Well, honestly, I understand if it's a stat med because you need it right away,
Or, you know, antibiotics. But I'll wait for the med.
she keeps throwing shade.
She's like, y'all take a while, but
No, because I understand if it's like a stat medication, but then some people or like some nurses call and they're like, it was due at 4. Like, where is it? And the run doesn't go till like 4:30. You know what I mean? And then sometimes like we just finished making it, or they happen to miss the 3:30 run or something. You know?
Yeah, I understand that. So
And then you
I
guys
won't be
also could
bugging.
come down to the pharmacy and get it, but that's just my.
That's what I always say. But most of the time, I like to wait for it because I know you guys are busy too. And I mean, there's no rush, you know? It was just late. You still have 30 minutes after, an hour after to give it. It's not like you're going anywhere. You have the whole night.
Yeah.
I think something that bothers me sometimes is that nurses will call for like missing med or whatever. And like, let's say it's like, I don't know, like 2:45, like the runner just got back from the run. They're not going to go again until 3:30. And we'll tell them like, oh, hey, we'll get it ready. You can come and get it, or it'll go up on the next run at 3:30. And a lot of nurses sometimes are like, you know, like that's 45 minutes later. That's a long time. And they'll say like, oh, okay, I'm going to come down for it. And they never come down for it.
No, yeah. They just wait till the
Yeah,
run.
most of the time it's because we plan to go down for it, but then it's like in those times that you want to go down for it, all of a sudden someone's dying, or they want you for something, or they need you all of a sudden for something. So that's probably why. But I think it's just that they get busy.
I only run it to the units that I like.
Yeah.
What's the T? What unit do you like? My unit, of course.
Yeah, I always say that her unit is so unproblematic. Like I barely go up there. I think I go more
Yeah,
towards
not very often.
I go more towards 5 North than her side. I like CCU because it's just right there. What other floor do I like? That's
I
it.
don't love the ER, but I mean,
It's-
understandably, the ER is chaotic.
Is ER big? I haven't been there.
Yeah, there's like 4 sections.
It's a good size, but like nothing
Okay,
compared to
so-
UMC.
So it's like a middle
Have
section.
you seen the ICU?
Yes, we go in there
I
all the
thought
time.
the ICU was so much smaller.
Yeah.
It's like a whole square.
Yeah, it is.
I didn't know
I
that.
think it has like 20,
Like 20 something beds.
26 beds, something like that.
Yeah.
Honestly, like when the time my patients have coded, I thought it was just that one straight hall and that was it.
No.
Until I
Oh.
actually like walked around, I was like, oh, this is a bigger ICU than I thought.
Yeah, the ER is like the main room, and it has like curtains on the left side, and then some rooms, and then there's a back section, and then there's a section like in the front.
To give you a little idea, the ER has 4 Pyxis.
Oh, that's big.
There was one that I couldn't find. Remember, I was texting you, and I was like, "Where is this
Yes.
princess?"
It was funny. Which funny story in terms of when, because you guys kind of started around the same time. Or I think Celeste started a little before you.
Yeah, she did.
And then
Like a
Clarissa
couple months.
started, right?
Yeah.
But I was training Clarissa because she was a new intern at the time, technician intern. Same difference.
Interchangeable.
And I was training her as runner that day. And since Celeste works graveyard, we knew that she was going to come in at 7. So starting on the 7:30 run, like every run, Clarissa would be like, let's go visit Celeste.
And he would say no. He wouldn't let me go.
Because I was like, if we need to go 5 South,
I'm
sure.
just popular.
Oh
But
my
no, I was telling her, I was like, no, girl, like we got something to do. If you don't got to go to 5 South, you're not going to 5 South.
Yeah, he
I should
wouldn't
have
let
called
me
for
go.
a man.
He wouldn't let me go visit you. I was like, please, Chris, I want to see her one last time.
She has attachment issues.
I think it was a busy night too. I was like, no.
Yeah, it was a busy night. That's why you kept telling me no. I was like, please. How about, can you tell us your experience as a tech? Because if you guys didn't know, Celeste was also a pharmacy technician.
yes.
Straight out of high school. But she never worked in the hospital setting. She only worked in like community setting. So like, what was your experience like as a tech? And did you like it? And how did you realize that pharmacy wasn't it?
Well, I worked at CVS. I liked it. I mean, it was my first like job, so I got to interact with like the people. I got to learn like medications. I got to learn insurance. I got to learn Karens.
Cheers.
I don't know, just working in retail, it's so much different than being an actual like nurse, you know? It's like, I don't know.
Do you feel like it helped you with your pharmacology classes?
Yes and no. I mean, yes, it's pharmacology, but I think they're different pharmacology.
Okay.
Like in the terms of what you had to focus on. But yes, I think it did help me because I was aware of some of the medications, what they were used for, and side effects maybe. But yeah, I think it helped. But in terms of being pharmacy tech, I liked it. I got to meet one of my close friends that I still hang out with, Elida. She worked in CVS, and then we went to school together. So that was kind of cool. But in terms of pharmacy, I think I just didn't like it because it just never changes. Like it's just the same concept. Like yes, it changes because you guys are becoming pharmacists, doctors, and pharmacy tech. So it's kind of just repetitive, you know. You fill the meds, you give the meds, you're a cashier, you're, you know, back and forth. And then people don't appreciate your job that you actually do. Like as a pharmacy tech, they don't know. They just see you as like, all you do is count pills. Oh no, that's not true because you have to deal with the insurance. You have to deal with the doctors. You have to deal with the specialty pharmacies. You have to do all that, and they don't see the behind the scenes aspect of it.
The little finger wave.
They just expect the medication to be delivered like fast food or, you know?
Yeah.
But it's like so much more. Like I feel like people just don't appreciate the career, the job.
I'm like, hallelujah, ma'am. This ain't McDonald's.
Yeah, people would literally come into a drive-thru and be like, I'll get a burger, and think it was funny. And we're like, you see the 50 other cars behind you? Let's get it done.
You're like, give me your name and your date of birth. What you here for? What
And
you here
then
for?
like
Make it quick. Come on.
they expect so much out of you, like in those companies, because they're big companies. So they expect you to be putting out as many scripts as they want, or
They
you
say
know,
money,
they have
money,
a goal in
money.
mind. But we're people, not machines. So
money, money, money. When we went to Spain, the taxi driver,
Yes.
Uber
yes,
driver,
yes.
he told us that he wouldn't move to America because we just work like machines.
we like the money.
He said, money, money, money.
He's right though.
Yeah,
And
he
you
is right.
guys, I know you guys work as techs still, right? That's what you consider yourselves.
Yeah, we're interns,
interns.
but you know,
interns / tech jobs.
interns that do tech
How
positions.
do you guys like? I'm throwing the questions at you guys now. How do you guys like it in terms of like pharmacy and hospital compared to like outpatient pharmacy techs?
Well, I've done outpatient and like community.
You've
and
never done
Chris-
outpatient?
No.
I've never
Chris
worked
has
He's never
outpatient.
suffered.
He ain't
Exactly.
never-
He's never suffered.
Well, honestly, okay, I always tell people that I always suffered through, what is it? It's because I worked at busy stores. So I worked at this, should I say the names?
Just say the
Okay, well, I worked
Yeah.
at CVS and I worked at Walgreens. And I feel like, I don't even know where I was going with that, but
I feel like
Just the pause.
yeah, it just disappeared from my head. Okay, so I worked at CVS and Walgreens, and there, I know the store that I worked at CVS was always super busy, and there, me and Celeste had kind of the same experience. Is like people expected us to just go, 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 and a lot of my coworkers didn't put in that work, so that's where I kind of was like, like at the time I remember working at CVS, I was like, maybe medical school is for me because, you know, they're not going to deal with this type of stuff like pharmacists do. But at the same time, in the back of my head, I was always like, pharmacy's for me, you know? But now working, pharmacy's for me.
And
But
don't
now-
get us wrong, we love our jobs. It's just, ooh,
Yeah, every job has pros and cons. But now that I moved to hospital pharmacy, I really like it. Even though we're interns doing tech jobs, I still like it. And I think it's kind of beneficial because some of our pharmacists, I feel like, don't really know how the pharmacy runs, if that makes sense. Like, they're like, oh, I don't know where this is, or, oh, I don't know how that works. Like, you know what I mean? And when you try to ask them for help. So I think it's good as interns that we're doing the tech job, because once we're pharmacists, we'll kind of understand the process. And I think we'll be more knowledgeable for our techs on how like the system works and like how things just generally run, instead of just doing the pharmacist job and not knowing how the tech job works too, you know? And I think they go hand in hand.
We'll go in with both perspectives.
more relatable to your techs.
Yeah. Yeah, more relatable to your techs. And I really I honestly like hospital better because now whatever we're learning in ISBP, we can kind of apply more in the hospital. But the more patient care is more, what is it, community? Because what would they always say? Like you're the healthcare professional that's more accessible. Like, you don't need to make an
That's true.
appointment to see us. You could just come up to the counter.
Right.
And that's the part I like about community, but then I like the clinical aspect of the hospital. So I think that's why I want to do ambulatory care, because I feel like it's both, like, you're helping the patient, but then you're also able to apply your clinical knowledge.
Yeah, and you're more able to communicate with like the interdisciplinary, like
Yeah,
how do
like
you
the
say
other
it?
professions.
Teams. Yeah, like the teams.
And then I think before pharmacy school, I didn't know about the other branches of pharmacy that there was. I just thought it was CVS and Walgreens.
Mm-hmm.
What about you?
For me, the only like outpatient experience I have is like our APs. So like we did 2 weeks in a community pharmacy last summer, and I was at Walgreens, and it was a good experience. Don't get me wrong, but it kind of just solidified that I don't want to do community. I think I like the patient interaction part of it, but I don't like. There's not as much like objective sort of ways you can look at whatever the patient is experiencing when it comes to community. It's very much, at least in terms of like over the counters, this is the symptom I have, this is what it feels like, and you're kind of just in a sense making a guess.
Yeah.
Whereas in like inpatient setting, you can look at labs, you can look at different tests and whatever, and based on those numbers make a better treatment option. And I've noticed too, like going through the pharmacy, for example, when we're filling the machines at work, I'll be going through the names or whatever when I'm filling them, and I'm like, oh, I know what this does now, and I know when to use this. Whereas I'm thinking about, like, I have my rotation in a week, and I want to brush up on OTCs because I don't feel comfortable recommending anything over the counter.
Wait, most of the pharmacists that I've worked with, they just look at the box and they're like, "Yep, every 2 to 6 hours." Like,
Which, it's a good method, and it'll help you learn. But that, and also I didn't understand insurance in school when we were learning to be a tech. I don't understand it now. I don't even handle my own insurance yet.
you're like, I don't even want to
So
understand it.
I don't want to deal with that, to be honest.
But in terms of Celeste mentioning that it is repetitive, I feel like community pharmacy, even as a pharmacist, is super repetitive unless you get that one person that makes a scene in the pharmacy. But you're just doing the same thing every day. And
that's something I like about inpatient. It can be unpredictable.
Yeah, because like say a diabetes medication isn't working for them, plus you guys can come and recommend, well, there's this one, this one, this one. Maybe it can work out. Let's look at your labs. Let's look at, and then plus in the community pharmacy, these people are already used to what they're taking, so you're just dispensing it to them.
yeah, and it's easier to talk to the doctors in the hospital to switch the medication or talk to them about why it may not work for that patient. Whereas like you're working in the community pharmacy, it's so hard to contact the doctor. They don't answer you.
Yeah.
They don't want to answer you.
And also, like, you guys are able to more critically think and use your, like, laboratory, like, studies. And, like, for example, like, Vinco trials. Like, you guys know how to adjust the doses and all that.
Not yet.
Not yet. Eventually.
Which I know I had a question that kind of is for both of you. Maybe there's an answer to it, maybe not. But you went into nursing and you're going into pharmacy. So you both have pharmacy classes under your belt. But is there ever a time, because I know you guys helped each other study, so are there ever times that like you guys maybe not so much conflict on a sort of medication, but you kind of debate a medication? Like, for example, I saw a TikTok of a med student saying that metformin causes weight gain, and I was like, no,
Absolutely.
no, it does not.
Honestly,
I don't think I argue with her in medications. I think more like diagnosis is, if you guys are, sometimes I like to help her study with her tests. But in terms of like diagnosis, I'm like, I remember this. Like, I'm telling you, this is what I remember.
oh yeah, and sometimes like, no, it's different for pharmacy. It's different for nursing. Like you.
But in terms of medications, I think I'm going to listen to her because she's learning pharmacy. I'm not going to question it. But if it's like in terms of like diagnosis or symptoms and signs, then I'm going to be like, no, I remember this, or try to remember like this, you know?
But then Celeste is also very knowledgeable because she's actually experiencing firsthand, like giving the medications and what they do. Because us, we're like, okay, yeah, it does this, but maybe sometimes we're not like, oh, it really does cause these side effects.
Yeah.
Like she experienced the side effects of the medication right there.
Yeah, like before giving him drug, I have to really like think like, okay, like his blood pressure is like 106 over, I don't know, 96. Like right now it's fine. But he has like hydralazine 100 due. I'm like, should I give it or should I hold it? And then I'm like, But then you look at the trends of how his blood pressure's been, and it's been like 170s over something. So you're like, he has a chance to go up. So, but you can always just go take the blood pressure again and see where they're at. So nursing isn't just, let me go I think people think a lot of nursing is like being like, how do you, Clarissa used to say it a lot.
No,
like,
I didn't. Don't
she
out
used
me.
to say,
Don't out me.
she used to say we were like glorified
Nope, don't say
maids
it.
or something.
Don't say it.
She used to tell me that, and I used to get my feelings hurt because it's more than that.
Say it. My
Like-
professors are they're gonna be mad at me, please. They're gonna
Like-
be like, why do we go to these IPEs if you're just gonna
Like, I mean, she says it to me because I'm her sister, but like, it's so much more than that, and people don't understand that, you know.
I just can't handle that,
that's
girl.
another other tangent we can go into if you want, but
I think you're kind of telling us too that like we're constantly told that a lot of our treatment options are going to involve our clinical judgment. Y'all have to have clinical
But,
judgment
yeah,
too.
we have to have clinical judgment too because we're with the patients for 12 hours, you know. So like, say if Juanita comes in, 9-year-old little Juanita, and she's doing well, and then you go in, and all of a sudden she's like using her accessory muscles to breathe, and she's short of breath or like tachycardic. You have to like, what's going on with Miss 9-year-old Juanita, you know, or with them like. I don't know. We just have to use the clinical judgment in terms of giving the medications. Like, how is this going to affect my patient? Is it going to bottom them out, and then we're going to have to be dealing with like a code or something? You know, you just have to learn how to read your patients. Like, it's more than like, yes, you clean your patients and you take them something to eat if they want, or you know, stuff like that. Like, yeah, we're not the doctors, but like most of the times we're the ones reaching out to the doctors. Like, hey, this is going on. Like, their condition has changed, and we have to use our knowledge and be like, okay, maybe this patient's going into this, or maybe this patient's going into this, you know? So it's a lot complicated than what people actually think we are, instead of just like glorified maids bringing people things. Like, yes, that's part of the job. Like, I think like what makes someone a good nurse is that they're able to critically think, but at the same time they're also able to like relate to their patient and be empathetic to their patient, you know? Because you're with these patients in their most vulnerable times. Like, no one can teach. Like, I saw a post recently where it's like, your professor can't even like teach you how to do a bed bath or change the linen or like comfort family members when their family members dying. Like, they don't teach you that. It has to come from your heart. And you know, I think that's also why I went into nursing, because I love caring for people. And yes, it's hard for me sometimes, like seeing these people like go through changes, but you catch these people at their most vulnerable times, you know?
Okay, speaking of your most vulnerable times, can you go ahead and share like one of the most touching stories that you've had so far as a nurse? And then maybe you can transition into maybe horror stories that you've had, of course, without breaching HIPAA on any of these stories.
Pues,
I guess
sure,
start
I'll
with like your most touching story that you've had.
was my most touching story was it had to be my 2 hospice patients, you know. Those are always hard. My first one was really hard, because like, you know, I don't know what to expect in this situation. You know, I'm new, right? So you don't know what to do, or you mean like you're a nurse, so you're used to like saving people or seeing them at their best, you know, improving. So like, it's kind of hard when they're hospice and they're at the end of their lives. So I think it was touching because the family member was there, and you know, it was my first time, and they're crying, and they're hoping that their family member is going to come back and just be better, you know. They were praying for a miracle to happen. And I kind of just went in there. I introduced myself, you know, I'm going to be the nurse for tonight. Let me know if you need anything. I brought them water. I brought them like 2 jugs of water. I offered them juice, snacks if they needed. And I noticed that, you know, you're not supposed to bring religion into like a lot of your stuff, you know, and you really don't talk about religion or stuff like that, you know, because it gets like a sensitive topic, touchy topic. But, you know, I was in there and they were praying, and, you know, I went in and I was like, while I was introducing myself, I said, you know what, I don't know. I asked them what religion they were, and they said it didn't matter. So I told them that I'd be willing to stay there for at least one prayer, that I wouldn't pray or say anything, but at least I'd be there in prayer with them for at least one of their prayers. So I kind of held hands with their family members, and I just stood there for one of their prayers, and they were so appreciative that I did that. And they told me I didn't have to do that. And I told them, I mean, that's what I'm here for, you know, to be a support. So I kind of just, that meant a lot to me, just to be there and say a prayer with their family member. So I feel from there, they were more comfortable with me, and, you know, I think that was one of my more touching moments.
So it's about like making a connection with the
Making
family?
a connection with the family and the patient, you know, opening yourself to them and them allowing themselves to open themselves up to you, you know, and just creating that bond.
So the silence.
Yeah, they're never easy. Like, you don't know these people for like that long. Like, you're not there with them that long. But it's sad to see. So you try to offer as much help or empathy you can with them, you know.
Well, can you tell us about your horror story that you had recently?
Yeah. So recently I had a patient elope, which means he left
Elope.
hospital. He left the hospital without letting us know. He left with his IV site. He just up and left, you know. I tried to trust him and let him like walk his significant other to the elevator, and he dipped right in front of my eyes.
He said, "Bye, Felicia."
It's kind of embarrassing. I mean, he just left, and
It's kind of embarrassing.
I was watching him. That was the most embarrassing part, you know. I did go after him, but just I guess like a little dangerous. But during the time, I didn't think of it, you know. I need to get the patient back, you know.
She's like, "Where the hell are you going?"
He's running. I need him.
Was he in a gown?
Yeah, worst part, he was in a gown, but you know, he did some Houdini stuff and changed. And after that, I didn't see him. And then during the cameras, they saw him, that he changed and up and left. And there was nothing I can do about it. I just had to do my incident report. I mean, I did feel supported throughout the whole thing, you know, because it was my first time, you know. But I did feel supported by the staff, like the other nurses that were on shift with me. And my director ended up calling me saying that I was going to be okay, that I did everything I could. There was nothing in that situation I could do anymore. And that she was glad I was safe, because we're not sure what he could have done if you just wanted to like smack me or, you know, even worse, like injure me somehow, because he was just trying to get away. That was my horror story. I've been going through a tough time. I think our unit needs a cleanse.
Honestly, she has been going through a tough time. She always texts us. That night that it happened, she was like, "I need a cleanse." And I was like, "Oh no, like what happened?" She was like, "My patient ran away." And I was like, "Oh,
My coworkers are always like, "You're gonna have so much experience under in your 1 year of working." I'm like, "Yeah, because everything happens to me."
They're like, "Gee, thanks."
Like, thanks.
You know what? Like it reminded me of. She probably like.
When I tell you I sprinted into the elevator.
No, that's what I was about to say. Like, you probably got to, like, the lobby floor looking for him. And to me, like, I imagine, like, you know, like,
I sprinted to that front entrance.
if you're editing the video, maybe you can, like, pop in a picture of, like, Ape SpongeBob where he's, like, or, like, Mr. Crab where it's, like, spinning. That's what I imagine Celeste.
I think it was more Ape SpongeBob running down the hall. Like, where is he?
He probably, like, stopped on another floor, to change.
Yeah, I think this was really, really well meditated. Like, he had to have stopped on another floor because they went down to the elevator before I did. So they should have ended up in the lobby before me, right? So I ended up in the lobby and I didn't see him. And when I was coming back, I saw the significant other passing me and I was like, "Where is he?" And she's like, "He went up." So I called the floor and I was like, "Is he up there?" And he wasn't. So
what would you have done in the case that you did find him? Like, slap him on the hand and be like, "Get back in bed."
You're like, "Get back up
there's
there."
Back up there.
I guess. I mean, I don't know in that situation if I would have caught him, what we would have done. I don't think.
Yeah, like, what were you thinking?
Honestly, all I was thinking was to get this guy back. Like, what? I'm gonna get in trouble. Like,
what were you gonna do if you found him? Like, "Hey,
go
sir," grab him by the wrist and like.
Yeah, basically, like in my head, I was gonna go after him, hoping I met him in the lobby, and then told him, like, "I told you to the elevator and back to your room. Let's go back to the room," hoping he would go to
And
the
you would
room.
have ridden the elevator back up with him?
Yes,
Ow.
I got him back. Or maybe I would have called or had security escort me and him back to the floor or something, or called the charge and let him know. Like,
She would have been like, "Let's go to the security office."
you know what?
together."
Holding hands.
I know.
After a couple of minutes, and then he wasn't coming back to the room, and I couldn't find him downstairs. I was like, "Tell the charge what's happening," because I hadn't told him what was happening yet. He knew that I was watching him, but he didn't know that I chased after the man
Oh, where was he?
at the nurse's station. But I guess he lost track, or he didn't see I took off. So, yeah, it was tragic. That was a tragic night for me. I couldn't go on after that. But it's just crazy how the world continues, because that happened and I couldn't find him. And security's like, "I'll call you back if I see something in the footage." And like, the world continued. Like, I was getting an admission, and I thought this was the end of the world. Like, this was my shift. And the world keeps spinning, guys. I got an admission.
one? They were like, you just lost a patient? Here's a brand new
Here's a
one.
replacement.
No, the worst part is I was at 4, so this person was gonna be my 5th one.
Wait, after you lost that one, you had 5?
Or he was 4, and then you were going to get a 5th.
Yeah, he was 4, and I was gonna get a 5th.
Well, so then you only had 4.
Oh wait. Yeah.
So his bed was just empty, or you had to clean
No,
it?
the bed was empty until we. Luckily, my charge. He's such a good charge. He didn't unblock the room, or he didn't say that the room was empty. He left it in the system as it was still full, and he let me catch up on everything that I needed to, like med pass and everything. And then he said once I was done, he then like unblocked it and we stripped the room, and then they went to go clean it, and then I got another admission.
So then you had 5.
So then I had 5.
So did you just forget about him?
I mean, I had to. We called PD and everything, but
I'd be like, well,
it
we
was.
still
It
lose
was
some.
That's all I can do. at
we
this
wanted
point.
the best for him. It was his doing. You know, nothing
Yeah.
I could do.
Hey. But do you have any more questions for Chris?
I don't. I kind of asked everything I had.
I think I asked everything I had to. Well, we just want to thank you for coming onto the podcast. We know you were a little shy in the beginning, but I think you opened up.
Yeah, I hope this episode isn't bad, or I don't look as bad because I can't really see in the.
No, you look fine. You look perfect. We wave. Okay.
Or I'll
Well,
wave
we'll
it to
just
the
give a little shout outs to our other social medias first. I'll go ahead and go first. If you guys want to keep up with our
Thanks
posts,
for having me on.
Oh, you're welcome. If you want to keep up with our posts and be notified about when our new episodes are coming out, you can follow us on Instagram at When the Pharmacy Closes.
You can follow us on YouTube for the video versions at RX Closes Pod, or on TikTok at our WTPC.pod.
And I think that concludes the episode for today. Thank you so much, Celeste, for coming on here and explaining your nursing career and giving us a little bit more insight. And then it also gives me a little more insight on how we can work more closely, I guess, with the nursing profession.
Yes, thanks for having me on. I hope you guys are able to open up to the nurses.
Open up to the nurses?
Yeah, I mean, not all of us are the same, so
Well,
give us a chance.
No. Generally, nurses are like good to work with. There's just the select few in
We do God's work.
any career field.
Just kidding.
There's just a select few that are not fun to work with.
yeah, just them. But anyways, thank you guys for listening. See you next week.
Bye, y'all.
Bye.